My name is Abdullahi. I was asked to recall what Doctor just explained to me now in Hausa. He was trying to explain what epidemiology of HIV disease, where he say epidemiology means distribution and determination of health-related events in a specific society or population. Then he also tried to explain what prevalence is. He said the percentage of population that are affected by disease or from a disease in a particular community. I also tried to explain what epidemic is, which he said is widespread occurrence of an infection in a community, and pandemic, when we have epidemic, what is globally, he says is pandemic. Then he now move further by trying to tell us the amount or how prevalent this disease is. He says considered by some authors a global pandemic. However, currently, he said there is currently the use of the term global epidemiology to describe HIV. Then he also mentioned that since the first case was discovered in 1981, this virus continued to be one of the most prevalent diseases globally or affecting the whole world. Center for Disease Control suggested that HIV disease continued to be a serious health issue for several parts of the world. And he also tried to tell us the amount of people, how often the disease is, where he said there is about 1.7 million new cases worldwide. That is new cases that is detected almost every year. Then he also said in 2018 about 37.9 million people were living with HIV. That is from the statistic made in 2018 that 37.9 million people were affected. They also move further and say 24.5 million people are receiving treatment. Like there are people that are detected and they are receiving treatment from the health center. And roughly 770,000 people died from HIV-related illness globally. Then he said, therefore, accessibility to tests will play a significant role in controlling the diseases or in mitigating the widespread of the disease. He said approximately 81% of people with HIV globally know their status. As they have been tested, they know they are HIV positive. And he said HIV testing is an essential gateway to HIV prevention, treatment, care, and support. As by testing, you know your status and you prevent the widespread of the disease. It says globally 38 million were living with HIV in 2019 and 25 million people are on drug in 2019. 690,000 died in Nigeria and 900,000 people are living with it. That is what he tried to tell me in Hausa, which he asked me to translate in English. Thank you very much.
Sunana Sadisu ɗalibi a mataki na biyar wanda ke karatu a jami'ar Usman Danfodio da ke garin Sokoto. Ina karatun gefen lahiya. Zan yi bayani, ina tare da Abdullahi. Zan yi masa bayani akan abin da shafi kanjamau a harshen Hausa. Kuma in na yi masa bayani na gama, ina so ya maimaita min abin da na faɗa zuwa harshen Turanci. To bayanin da zai masa akai shine kanjamau, abinda yawan aukuwan kanjamau a cikin ƙasa Najeriya da kuma duniya baki ɗaya. Epidemiology kenan. Epidemiology abin da ake nufi da epidemiology shine karatun da ya shafi rabe-rabe da kuma bayanai akan cututtuka da ke faruwa a ƙasa. Sannan zan yi bayani akan prevalence, shine percentage na population da ke da fama da cutar kanjamau a cuta da baki daya a waje haka ko a gari ko a community. Sai kuma epidemic shine yau aukuwan cututtukan a cikin gari haka ƙauye guda daya shi kuma pandemic, abin da ake nufi da pandemic faruwan cututtuka a ƙasa baki daya. To shi dai ciwon kanjamau din ga masana da yawa suna cewa abu ne wanda ya shafi cuta ƙasa baki daya, wasu kuma sun ce duniya baki daya. To yanzu dai ciwon kanjamau din ga yana damuwan mutane da dama tun sanda cutar ta bayyana a ƙasa 1981. Cutar ga yake ta hawa yake ta karuwa, yana ta girma a duniya baki ɗaya, kuma ya zama abun ban tsoro, abinda mafi yawa wasu na mutuwa a kan shi da sauransu. Ƙungiyar CDC, Center for Disease Control, wanda ake ce wanda suke kula da ɓangaren duk cututtuka da suke shigo mutane a ƙasa, sun ce wannan cuta ba abun wasa ba ne, kuma a kula da shi, kuma a kula da hanyoyin da ke samun mutane saboda abun da akwai kusan 1.7 miliyan na mutane da suka kamu da cutar kanjamau a shekara ta 2018. Sannan CDC, Center for Disease Control, sun ce akwai kusan mutane miliyan 37 da ke fama da wanga cutar a gaba ɗaya duniya a 2018. Sannan a cikin mutane 37 ɗin da suke fama da cutar ga duniya baki ɗaya, da mutum miliyan 24 ne suke shan magani a kan shi. Sannan kusan mutane 770 sun mutu a kan wannan cutar tun lokacin da cutar ta faru zuwa yanzu ga. Saboda haka ana neman mutane, gwaji shine zai iya nuna mutanen da ke fama da wanga cutar, sannan kuma zai kawo taimako a gane mai cutar saboda a bashi magani, sannan wanda mai cutar shi ma ya san mai cutar saboda kare kansa da sauransu. Kusan kimanin mutum kashi 81 cikin 100 na mutane duniya da masu fama da cutar kanjamau ɗin ga sun san suna da shi. Kaga kalilan ne wanda ba san suna da shi ba. Wannan gwajin zai iya taimakawa sosai wajen kawo ƙarshen ko kuma a rage yawan aukuwan wannan cuta a faɗin duniya baki daya. A nan zan dakata, zan nemi Abdullahi ya ɗan ce wani abu akan bayanin da na yi masa da harshen Turanci. Mana Abdulbasit, bismillah.
Thank you very much. My name is Abdullahi. I will like to translate briefly what he said in English. He started by telling us what epidemiology is all about. He said is distribution and determination of health-related states and events.
Good evening, everyone. My name is Mohammed Mukhtar. I'm a 600 level student of Ojanomare University, Sokoto. I will talk about the mode of transmission of HIV infection. Mode of transmission simply means ways or means by which HIV infection is transmitted from one person that is infected to another. Usually, HIV infection is transmitted via exchange of some body fluids. Some of these body fluids includes blood, semen, vaginal secretions. HIV infection also can occur in pregnant women that are infected with HIV, can transmit the HIV also to the infant or to the child. The first means of transmission is by sexual contact. There is a sexual contact between infected and non-infected person. HIV can be transmitted by that means. So unprotected sex and also having multiple sexual partners is one of the risks of having HIV infection, getting HIV infection. Also, transfusion of blood that is unsterilized or unsafe blood transfusion. HIV can be transmitted by such means. Not just blood, also blood products too can also pose a risk of transmitting HIV infection. Intravenous drug use. Those that inject themselves with drugs intravenously also use to share the needles they use with other people that are not infected, and these also can be a means of transmitting of HIV infection. Also, needle stick injuries, especially in health workers, is also a means of transmission of HIV infection. Sharing needles and shafts and objects also between the infected and non-infected individuals also is a means of transmission of HIV infection. In pregnancy, an infected pregnant woman can transmit HIV infection to the child via 3 means. This form of transmission generally is known as vertical transmission. First, during pregnancy, the child that is in utero, the mother can transmit HIV infection. The mother that is infected can transmit the infection to him through blood because they are connected by a circulation, the utero-placental circulation. Then, during labor and delivery also, if the child didn't get the HIV in utero as he is about to be delivered, through the birth canal, the child can also be infected with HIV. Also, after birth or after delivery, during breastfeeding, also the child can get the HIV from the breast milk, though this mode of transmission is usually less compared to the other two. So these are the ways by which a person can get HIV infection from someone that is infected. At this point, it is important to note that kissing, hugging, sharing clothes, or eating or drinking with the persons or the individuals infected with HIV did not pose a risk of having or getting HIV infection from that person. So that means saliva, sweat, ocular fluids, all these and others cannot be a means of transmission of HIV infection. And as such, the take-home message here is, by knowing this means of transmission of HIV infection, we should be able to prevent themselves. We should be able to prevent ourselves from getting these infections by restricting or restraining ourselves from such acts. We should make sure that the blood that is about to be transfused should make sure that it is screened from HIV infection and other infections that can be transmitted via such means. We should try as much as possible to perform or to prevent ourselves from having an unprotected sex, avoid intravenous use, drug use, avoid sharing sharp objects and needles, and also stop stigmatizing those with HIV because it cannot be transmitted by the means I just mentioned. That's the kissing, hugging. We can interact with them through all those means without getting a risk of getting the infection. So this is the end of my presentation, and I will use this medium to say to you all, Happy World HIV Day. Thank you very much. Bye.
Hello everyone, this is Quinita from the University of UNIUYO. Happy World AIDS Day to each and every one of us. In celebration of that, I'll be talking on nutrition in HIV and AIDS, the role of nutrition in the management of HIV and AIDS. Nutrition is a process by which the body utilizes food. It includes eating the appropriate kind and amount of food for the body's needs. Digestion of the food so the body can use the nutrient, absorption of the nutrient and elimination of waste. Good nutrition and healthy eating can help to maintain and improve the performance of a person's immune system. And this system is especially important in persons living with HIV and AIDS. The relationship between nutrition and HIV is a vicious cycle similar to the relationship between nutrition and other infection. HIV compromises nutritional status, and poor nutrient further weakens the immune system, increasing susceptibility to opportunistic infection. This cycle can result in weight loss, which is the most common and often most disturbing symptom of HIV and AIDS, loss of muscle, tissue and fat, vitamin and mineral deficiencies, increased nutritional needs because of the infection, metabolic changes, viral replication, and poor nutrient absorption, weakness and reduced productivity, reduced immune function, and increased susceptibility to opportunistic infection. Nutrition care and support can help break this cycle by helping people living with HIV maintain and improve their nutritional status, boost their immune response, and manage the frequency and severity of symptoms, and improve their response to antiretroviral therapy and other medical treatment. This can be achieved through adequate nutrient-dense diet, proper hygiene, food safety, exercise, and nutrition or dietary management of symptoms. For meals to provide adequate nutrition and promote well-being, they should comprise of a variety of food, such as energy food. We have rice, whole grain, cereals, yam, banana, fats, sugars, all for extra energy. Bodybuilding fruits and foods such as lean meat, chicken, fish, milk and milk products, beans, peas, etc. Protective food such as fruits and vegetables. Water, it should be clean, safe or treated water. Nutrient requirement depends on the stage of the disease progression, and the intake levels are based on the absence or presence of symptoms. Energy food like carbohydrate gives energy, and to get enough of the right type, one should eat 5 to 6 servings of fruits, vegetables each day. Choose legumes and whole grains such as brown rice and potatoes. If one is diabetic or pre-diabetic, then most of the person's carbohydrates should come from vegetable. Limit simple sugar such as candy, cakes, cookies, or ice cream. Bodybuilding foods such as protein help to build muscle, organ, and a strong immune system. To eat the right type, choose extra lean pork or beef, skinless chicken breast, fish, and low-fat dietary products. To get extra protein, spread nut butter on fruits, vegetable, or toast. Add cheese to sauces, soup, potato or steamed vegetable. Add canned tuna to salad or casserole. Fat provide extra energy. Foods such as fatty meal, poultry with skin, butter, whole milk, dairy food, and coconuts are good sources of fat. Vitamin and mineral regulate the body's processes. People living with HIV and AIDS need extra vitamin and mineral to help repair and heal damaged cells. Vitamin A and beta-carotene can be gotten from dark green, yellow, orange, or red vegetables and fruits, liver, whole eggs, and milk. Vitamin B can be gotten from fish, meat, chicken, grain, nuts, white beans, avocados, broccoli, and green leafy vegetable. Vitamin C can be gotten from citrus fruit, and vitamin E can be gotten from green leafy vegetable, peanut, and vegetable oil. Selenium from whole grain, nuts, poultry, fish, egg, and peanut butter. Zinc from meat, poultry, fish, beans, peanuts, milk, and other dietary products. Because it is difficult to get enough of all nutrients one needs from food, people living with HIV and AIDS are recommended multivitamin and mineral tablets. Management of health-related symptoms that compromises feeding. We have anorexia, which is appetite loss. We are advised to eat favorite foods, eat small frequent meals, and use dense food. Avoid strong-smelling food. Avoid hazards of smoking and alcohol use. Also, diarrhea, which refers to 3 loose stools per day. Drink lots of fluid, boiled water, low-fat soup, fresh fruit juice, weak tea, and fermented porridge. Consume food rich in soluble fiber to help retain fluid. Example, millet, banana, pea, and lentil. Nausea and vomiting. You're advised to eat small, frequent meals. Eat salty or dry food like crackers and toasted bread. Take soup, unsweetened porridge, and fruits like banana and other fluid after meal. Avoid greasy, spicy food, caffeine-sweetened food. Avoid empty stomach as this worsens nausea. Also, for mouth sores and thrush, eat soft mashed food and potatoes, carrots, scrambled eggs, banana, etc. Eat food at room temperature. Drink plenty or energy-dense drink. Drink fluid with a straw to ease swallowing. Practice good oral hygiene and gargle small amounts of bicarbonate soda in warm water or use garlic water. Anemia indicated by fatigue, pale hands or fingernails. Recommend increased consumption of lean meat, dark poultry, meat and fish, dark green vegetable, especially traditional vegetable. Vitamin C rich food, citrus fruits. Avoid tea, coffee, meal, and cocoa at mealtime that inhibit absorption. For constipation, you're advised to eat high fiber food, drink plenty of fluid, 8 glasses per day, especially if on diuretics. Avoid processed or refined food and use of lactative. Regular exercise is advised. For loss of taste and abnormal taste, you're advised to use flavor enhancers such as salt, spices, herbs, lemon. Practice good oral hygiene. Rinse mouth after meal. Chew food well and move the food around the mouth to stimulate receptors. Use lemon, tonic water, vinegar, or raw tomato to stimulate taste buds. Ensure food hygiene, as this is equally vital to promoting healthy living. Healthy nutrition plays a central role in the management of HIV and AIDS associated symptoms. It enhances the therapeutic effect of the medicine given. It also boosts the immune system, thus helping to fight against opportunistic infection and to maintain body weight. It prolongs the progression of HIV infection to AIDS. It also increases longevity and promotes healthy living. Also, having the right attitude towards living can equally promote the overall well-being of the patient. Thank you and remain blessed.
Good evening, everyone. My name is Ojanomare John, a fifth-year medical student of DELSU State University, Abraka. Today is World AIDS Day, 2nd of December, which was initiated in 1988 to raise the awareness of HIV amongst the population of the world. I'm going to be giving a short teaching on the stages of HIV. The stages are 4. Stage 1. It occurs between 1 to 4 weeks after getting the HIV infection. And some people don't have symptoms. And the symptoms of people who present with symptoms include fever, rash, headache, sore throat, swollen glands, muscle pain. These symptoms occur as a result of reaction of the body to the HIV virus. Having these symptoms does not necessarily mean that one has HIV. Stage 2. Stage 2, also known as the asymptomatic stage, that is, no symptoms. In stage 2, there is a recuperation or a recovery from the symptoms of stage 1, which gives a false impression of cure, and this can last from 10 to 15 years. But underneath, there is a continual replication of the HIV. Stage 3. In this stage, the person's immune system is severely damaged. They are more likely to get serious infection and diseases, and these infections are known as opportunistic infections. Opportunistic infections are they are infections that are fought off naturally by the body. But when there is an invasion of HIV, the body lacks the capacity to fight off these infections, and it gives the following symptoms: weight loss, night sweats, chronic diarrhea, fever, persistent cough, mouth and skin problems. Stage 4. Stage 4, also known as AIDS. Underneath, there is a continual replication of the HIV. Stage 3. In this stage, the person's immune system is severely damaged. They are more likely to get serious infection and diseases, and these infections are known as opportunistic infections. Opportunistic infections are they are infections that are fought off naturally by the body. But when there is an invasion of HIV, the body lacks the capacity to fight off these infections, and it gives the following symptoms: weight loss, night sweats, chronic diarrhea, fever, persistent cough, mouth and skin problems. Stage 4. Stage 4, also known as AIDS. It develops when HIV has significantly weakened the immune system, and the symptoms include a persistently high fever greater than 37.8 degrees Celsius, night sweat and chills, white spots in the mouth, pneumonia, significant weight loss, genital anal sores, severe fatigue, cancer. It takes at least, without treatment for most people, 10 years for HIV to progress to AIDS. And I'll conclude by saying, the above symptoms, especially stage 1, does not necessarily mean that one has HIV. HIV is confirmed by proper testing in a well-funded lab. So when one presents with the following symptoms, we should go for testing. Thank you very much.
Ladies and gentlemen, my name is Abdullahi Muhammad, a 600 level medical student of Ojanomare University, Sokoto, Nigeria. I'm here to present on the diagnosis of the virus, human immunodeficiency virus. First of all, human immunodeficiency virus, the diagnosis starts from the history, which will be presented by my fellow colleagues, and the examination findings, which now points to whether there's need for diagnostic modalities, that's the investigation. Now, among this investigation, the aim of doing an overall investigation, one, is to assess the viral load of the patient, to stage the disease of this particular patient, because HIV is in stages, so you try to stage the disease using the investigative modalities. You check if there are other comorbidities in this patient, as well as to assess the overall physical status of this particular patient. Now, a patient who is suspected to have human immunodeficiency virus, the HIV virus, upon presentation, he does the rapid diagnostic test, that's the RDT test for HIV, and ideally this test can be positive even just 3 weeks or 28 days following infection with the deadly virus. That's when they can detect the antibodies in the body. However, standard seroconversion of this HIV virus occurs usually 6 months post-infection, that's 6 months after a person is infected with this virus. Now, this rapid diagnostic test, the recommendation by World Health Organization is that for a physician who is assessing someone who has HIV virus, there is meant to be it has to be voluntary. The patient has to come voluntarily to the facility before this diagnostic test is carried out. And secondly, the person carrying out this test has to maintain confidentiality between him and his patient. Now, after maintaining confidentiality, whatever the test says, he has to counsel this patient adequately so that the patient will know the way forward. Some of the reasons why this diagnosis of HIV has to be voluntary by the patient is because in this era where a doctor can easily be sued by his patient, the patient has to come voluntarily before you do the HIV test, because if you do the test and he is positive without his consent, then he has the right to sue a doctor who carried out that test. Now, for the rapid diagnostic test, because it takes 28 days before it can detect the antibody in the patient's blood, this 28 days is called the window period. As such, that is a stage of transmissibility. It can be transmitted from one patient to the other, such as the intravenous drug use partner can also be infected during the 28 days window period where the person has not confirmed having HIV. Then also his sexual partner, maybe his wife or others, he can also infect them in these 28 days, because although the antibody is not present in the circulation, he is also infective. Now, the rapid diagnostic test checks for the antibody. Then after 6 months, you can do viral load and assessment of this patient to quantify the HIV virus in the blood using polymerase chain reaction, using various checking for the RNA nuclei in the blood. Also, the virology study that is being done checks it tends to also classify the virus which is found in this person, that is the subgenotype, and to determine the particular species that is causing the infection in this patient. Now, aside from that, other ancillary investigations are also done, one of which is the hepatitis B surface antigen testing, hepatitis B complete profile, as well as the hepatitis C virus. Why? Because the hepatitis B, the hepatitis C, and other hepatitis viruses have the same route of transmission like the HIV virus. As such, testing for this other virus is also important. Now, apart from that, the other ancillary investigation the person can do include the full blood count and differential, where the patient might have elevated lymphocyte count, that's the white blood cell will be elevated. This is trying to tell you that the patient has this infection and the white blood cell is increased so as to fight against this infection that is building up in his body. Also, the person can do electrolyte, urea, and creatinine so as to assess the patient renal status. Remember, I said initially, all of this investigation and the subsequent ancillary investigations are meant to check if there are other comorbidities that might impinge on the outcome of this patient with human immunodeficiency virus. The person can also do liver function tests to assess the status of the liver, and the patient can also screen him or herself of other sexually transmitted diseases. It's also important for this patient who is being diagnosed of HIV to also present his or her partner to the facility so that they can assess the patient, because he doesn't know if he has infected his partner, or if he's an intravenous drug user, he has to present his intravenous drug use partner, so that he can also be assessed if he's positive for HIV virus. Overall, following these investigative modalities, the patient has, after he's taking medication, he has to also be assessed regularly for the viral load itself. If there are viral antibodies in circulation, his overall function will be checked, such as his liver function, his renal function, and also like the blood count, all of which have to be monitored regularly using diagnostic modalities. Thank you very much. Signing out, Abdullahi Mudathir, Mohammed, 611 Udut.
Good day, everybody. My name is Chilaka Victor, and I'm a final year medical student of ABSU University, and I'm going to be talking about the traditional myths surrounding HIV infection, especially as regards to Africa, its stigma, and the role of psychological support in the disease. Top of this list is that one can get HIV by just being around people that are HIV positive. This has been proven to be false. As a matter of fact, one cannot get this disease by hugging, kissing, or sharing plates or cups with people living with the virus. The second myth that is driving this HIV virus in sub-Saharan Africa, more specifically, is that women that have HIV cannot have healthy babies. As long as you take your drugs and you plan your pregnancy with your doctor, with your healthcare specialist, women living with HIV positive, women that are HIV positive can give birth to HIV negative babies. It's been proven, and that is done through what is called a program called the Prevention of Maternal to Child Transmission. Okay, another myth surrounding the virus is that people living with the virus must die, or that HIV infection is a death sentence. HIV infection is not a death sentence. As a matter of fact, if you take your antiretroviral drugs, how you should take them, and as early as possible, if you start as early as possible before the progression of the disease, you can live a long and healthy life. So HIV is not a death sentence. There are established protocols of management for the disease. So it is not something to commit suicide over, or it's not the end of the road for somebody that is living with the virus. Okay, another myth is that HIV is a disease of homosexuals, which is false. Anybody can contract HIV, whether you're a homosexual or not. Another myth is that HIV infection can be treated with traditional medicines. You can hear people tell you that there are drugs that can be used to cure HIV. Those things are false. They are false news, and it just goes to contradict already existing protocol concerning the management of HIV. There are no drugs as of now yet for the cure of HIV, but there are drugs available for the management of HIV. Another myth is that people that live, let's say a couple living with HIV, can have unprotected sex. That is a myth. Even if you're living with HIV, you can still complicate the disease by just having unprotected and unsafe sex, because there is a risk of contracting some resistant strains of the HIV by just having unprotected sex with your HIV positive partner as a HIV positive person. Okay, so I also want to talk about the stigma. There's so much stigma surrounding HIV, especially as concerned these drivers or these factors I just mentioned. People living with HIV are normal, everyday people, and they shouldn't be stigmatized. It is not, the disease is not a death sentence. They shouldn't be made to feel less human than they are. They should be given all the care and support. And sometimes this stigma also comes from even family members, and it shouldn't be so. So I also want to talk about the role of psychological support around institutions. There are student-friendly centers even that serve to counsel to people living with the disease, give them moral support, help them get through the emotional problems that come with living with the virus. There are support centers all around. There are organizations that provide psychological help, or for people living with the virus. So it is not the end of the road. This is to commemorate the World HIV Day today, 1st of December. Thank you very much.
Good day, my people. Today I wan yarn una about HIV and AIDS. Now, wetin be HIV and AIDS? HIV means human immunodeficiency virus. AIDS mean acquired immune deficiency syndrome. I sabi say this thing na big grammar, but make you just learn wetin I go tell you so. This HIV and AIDS, Oyibo bin discover this thing for inside 1981 for inside USA. Since that time, dem come say, make we keep one day, which be December 1st of every year, so that we go dey tell the public, we go dey teach them about this HIV and AIDS, so that plenty people no go dey get this wahala again. Good. Now, as I been talk before, I go teach una and I go educate una on the effect of HIV and AIDS for your sexual and reproductive health. Remember say, most of these people wey dey get this HIV and AIDS na through sexual intercourse. Now, the females, the women, na dem even dey more affected because their private part dey more fragile than the men own. Good. Now, make we also remember say this HIV and AIDS dey mostly affect people of reproductive age, meaning those people wey fit do wetin, wey fit give birth to children. So e fit cause plenty wahala. Factors wey fit increase the risk of exposure for women, as I been talk before, say dem dey more fragile. Dem include multiple sexual partner, when you dey sleep with plenty people wey no even sabi anything about them. Forced sex, when person dey force person to sleep with am. Transactional sex, all these things fit increase the exposure for women. Okay, now how this thing dey affect your sexual and reproductive life or health? Make we start with the women. Remember say, e get wetin dem dey call immune system for your body. This immune system, e dey like the president wey be chief of staff to the armed forces, wey dey organize people, wey dey organize army and other people so that dem fit defend the country. Na wetin this immune system dey do. E be like the chief of staff wey dey fight all the whole yama wey dey enter your body. Now, if you get HIV and AIDS, e go reduce the way wey this immune system fit function. Because of that, other small wahala, other small infections wey this your body for fight before, e no go fit fight am again, and e go affect your reproductive system. E go come lead to wetin dem dey call infertility. This thing fit happen for both man and woman. Im be say, as a woman, e no go fit do wetin, e no go fit give birth, e no go fit conceive, e no go fit dey pregnant. as a man, you no go fit pregnant your woman. Good. If he other cause other things, so if he also cause other things. For men, if he cause something wey dem dey call epididymitis and orchitis, all these things na big grammar wey mean say those things wey you wey make up your reproductive system wey you dey carry pregnant your woman, e go get wahala. Good. Remember say when dem tell you say you get HIV and AIDS, no be good news, so na bad news. So because of that, most people dem go feel very down, dem go feel very degraded. Because of that, e go reduce their sexual activity and sexual drive. Im be say this thing wey dem dey call sex wey dey sweet dem before, e no go sweet dem again. So you see how e fit affect dem. For women, e go increase your risk of getting pelvic inflammatory disease. Im be say your private part, e go get plenty infection and e go dey worry you. Because of this, e go affect your wetin, your reproductive health. Good. Now, how we fit reduce this thing? One very important thing, education. Like as I dey tell you so, when we educate you, you go sabi how you go take carry your body, because you no wan make this thing affect your sexual and reproductive health. You wan dey born pikin normally, you no wan transmit this thing give your pikin. As a man, you wan perform normally, you no wan dey do wetin, dey get bad feelings when you wan enter bed. Thank you very much. My name na Idiong Obongsamuel Augustine. I be 500 level medical student inside University of UNIUYO, and na me dey tell una this thing now about HIV and AIDS and how we fit affect your sexual and reproductive health. Thank you, my people.
Good day, viewers. My name is Amatemeso, a 500 level medical student of the University of Calabar, Nigeria. So the 1st of December has been set aside since 1988 as World AIDS Day. It's a day dedicated to raising awareness of the AIDS pandemic caused by the spread of the HIV infection and to mourn those that have died of the disease. So one vital way to prevent this disease is health education, and that is the aim of this video. So HIV/AIDS affects all genders, all race, all age, but it's no respecter of person. But today I'm talking about women living with HIV and prevention of mother-to-child transmission. So this year, being the 32nd year of marking the World AIDS Day, the theme is global solidarity and shared responsibility. This theme is very apt for my presentation because preventing mother-to-child transmission is not a one-man job, but a job of the whole community and the government at large. So transmission from mother to child still forms a very large bulk of the new infections in children meaning from 0 to 14 in this case. So for every HIV positive woman, there's a 15 to 45% chance that her child will get infected if there's no intervention. But with intervention, this chance is less than 5%. So it's very important. About 1.4 million infections among children were prevented from 2010 to 2018 due to the prevention of PMTCT, prevent transmission from mother to child. So the first step in prevention is 1, preventing new HIV infection among women of reproductive age. Women of reproductive age refers to all women that have attained puberty and menarche, that they've started seeing their period. But one thing to note is that even a girl that has not attained puberty, if she gets the infection before attaining puberty, she will still have it after puberty. So basically, this is preventing infection in all women. So how do you do this? This part is basically by health education. You tell them how is it prevented, how do you get it, so that they prevent actions that can lead to it. And then for the hospitals, proper screening of blood for transfusion. There are still errors that occur where somebody gets infected by an infected blood transfusion. So the second means is preventing unintended pregnancies among women living with HIV. First of all, everybody should know their status. If you haven't done yours today, please look for a nearest health center and get it done. So for those that are positive, post-test counseling is very important. They should know that, they have it, but it's not a death sentence. They can still live a normal life. So, and they will still get married, they will want children. So they should talk to their physicians. They should get their numbers down. Their viral load should be very low before they get pregnant. So you should know that they should seek counseling before getting pregnant. Then for those that are pregnant, to prevent this transmission to their children, there are 3 steps. Prevent it while the baby is in utero, that's in the womb, while delivery, and then breastfeeding. Prevent transmission through breastfeeding. So if somebody's viral load is very low, there's a low chance that they will transmit it to their baby. So they should be on the antiretroviral therapy, that's the HIV drugs, to reduce their viral load. This should be even before getting pregnant. So for delivery is mainly the work of the birth attendants, the health professionals. So they should know what to do. There are preventive measures that to be taken. There should be no milking of the cord. There should be gentle suction, and then the baby should not be in contact with the mother's fluids for a long period of time. Then for breastfeeding, in developed countries, they don't even advise breastfeeding at all. But in countries where malnutrition is still an issue, you weigh the risk of infection and malnutrition. So if their viral loads are low and they're going to breastfeed, they should not mix the breast milk with other feed. They should breastfeed only strictly breast milk. So for the last approach is providing appropriate treatments for these children. They should be tested early. So this test, at birth, you cannot really say if a child has HIV or not. It's after 6 weeks that it can be confirmed. So in case your child is still and the doctor say come back in 6 weeks, it's not because they made a mistake. They have to test it again to be sure whether your child has it or not. But these children will be on antiretroviral drugs for the first few weeks of their lives. So with these few points, I think we can say that preventing mother-to-child transmission is not just the job of the mother or the job of the parents, but that of the community and the nation. So back to our theme, global solidarity and shared responsibility. Let's all come together and take responsibility together, and we will be stronger. Thank you and God bless. My name is Amatemeso, 511 medical student, University of Calabar, Nigeria. Thank you.
All right. Good day, everyone. My name is Isoma Hansen, a 511 medical student of University of Port Harcourt. I will make a presentation on childhood HIV infection. I want to appreciate Dr. Oge Sylvia for this opportunity and some of the other doctors that have helped to mentor us over the past 3 weeks. So I would like to take a global statistics of HIV, persons that are living with HIV currently. Okay, currently we have about 1.7 million persons that are newly be infected with the virus. Those that are on antiretroviral therapy will have 23.3 million persons. Okay. And then this is like genome and proteins of HIV. The genome of HIV consists of 9 genes, 3 structural genes, 6 non-steroidal genes, and then we'll have the TAT, the REV, the NEV, VIP. We'll have them well represented there. What are the modes of transmission? We have the vertical transmission, which can be intrauterine, intrapartum, postpartum, and whether through breastfeeding, blood products, sexual through child abuse, unsafe needles, sharp needles. Components of care of HIV-exposed infants: immediate care at birth, infant feeding, ARV prophylaxis, immunization, and vitamin A supplementation, Cotrimoxazole prophylaxis, growth and development, early infant diagnosis and follow-up. Okay, what are the immediate care at birth? The baby's mouth and nostrils should be wiped as soon as head is delivered. Okay, infants should be handled with gloves until all blood and maternal secretions have been washed off. The cord should be clamped as after birth, and milking should be avoided. Okay, cover the cord with gloved hand and gaze before cutting to avoid blood splattering. Initiate feeding within the first hour of birth according to the preferred and informed choice. The 6 criteria to assess suitability for replacement feeding: safe water, sanitation, caregivers can be reliable to provide sufficient replacement feeding, caregiver to prepare for frequently enough in a clean manner, exclusive replacement feeding, family is supportive, can access health care that offers comprehensive child health services. Okay, these are like who recommendations for exclusive replacement feeding. It must be acceptable, feasible, affordable, sustainable, and safe. ARV prophylaxis: estimated risk and timing of mother-to-child transmission in the absence of interventions. We have them here during labor. We have about 5 to 10%, and then the other ones can be taken care of here. Okay. ARV prophylaxis for infants. Infants should be started on daily nevirapine prophylaxis at their first encounter with the health services. Daily infant nevirapine prophylaxis can be started even more than 72 hours have passed since birth. Nevirapine should be continued for a minimum of 6 weeks if the infant is started on
or 12 weeks if the infant is initially on breastfeeding. Immunization and supplementation could also give the BCG vaccine, live vaccines, rotavirus vaccine, hepatitis B vaccine, and vitamin E supplementation. Okay, continuous also for those that will be exposed to pneumocystis jirovecii infection. So you don't have to, that the infection is more in those that are immunocompromised. Okay, for growth and development, we should watch the weight of the child, their length, study their developmental milestones. Components of I think we've taken care of this. Early infant diagnosis. Maternal HIV antibodies transferred passively to the infant during pregnancy usually persist for nearly 9 to 12 months in the infant. More reliable indicators of the HIV infection status of the infant are tests that detect HIV viral RNA antigens. Presence of Ig or IgM anti-HIV in the infant circulation can indicate HIV infection, but Ig or IgM anti-HIV assays are both insensitive and non-specific. Recommended virological testing schedules for infants exposed to HIV by perinatal HIV risk. Low-risk persons, infants, mothers receive standard ARD2 antiretroviral therapy during pregnancy, confirm HIV RNA level below lower limits, no concerns related to maternal adherence. High-risk infants, mothers with high HIV who do not receive prenatal care, did not receive antepartum or interpartum antiretroviral therapy, received antepartum antiretroviral dose only. Mothers who initiated ART late in pregnancy, diagnosis of acute HIV infection during pregnancy. Okay. Diagnosis recommendation. Early infant diagnosis, nucleic acid test can do DNA PCR, RNA PCR, a qualitative test done on dried blood film, and the RNA PCR provides additional quantitative information on virological status. This is done on plasma. Sensitivity and specificity of the both techniques almost similar. The presumptive diagnosis of severe HIV where there is no virological testing available can trigger to presumptive diagnosis of severe HIV infection, oral thrush, severe pneumonia, severe sepsis, recent HIV maternal infection, advanced HIV disease in the mother, CD4 in the child less than 2%, follow-up, nutrition, anthropometry, clinical, your voice history and physical exam, development, labs, hemoglobin levels, EU creatinine, CBC full blood count, CD4 count, labs, and then psychological assessment is also paramount. Basically, antiretroviral agents, we have them here. We have the nucleus reverse transcriptase inhibitors, non-nucleus reverse transcriptase inhibitors, protease inhibitors, and integrase inhibitors, fusion inhibitors. These various antiretroviral agents are usually better when they are combined. Okay, this is the mechanism of action. Management combination of at least 3 drugs or at least 2 classes of drugs is recommended. Drug combination for initial therapy in naive children include backbone of NRTIs plus NNRTIs and one protease inhibitor. Thank you for your very much.